Has someone you love begun to exhibit subtle, yet concerning shifts in their behavior or physical condition over the past year? It's a common misconception that the end of life in old age arrives suddenly. In reality, the body often sends quiet, almost whispered warnings months, sometimes even a full year, before its final stage. The challenge lies in recognizing these signs, as they often appear minor initially. It's only in retrospect that families realize the clues were present all along. But by then, the opportunity to prepare, to create those lasting memories, has passed. This is where health wisdom becomes invaluable. In this video, we're going to delve into 5 key signs that frequently emerge a year before an elderly person's passing, information that doctors don't always relay. Some of these signs might be familiar, perhaps even dismissed as mere aging, while others, seemingly insignificant, actually signal the body's gradual decline. Recognizing these signs early empowers you to provide enhanced care, cherish precious moments, and most importantly, ensure your loved one's final stage is imbued with comfort, dignity, and peace. Stay with us until the end, as these 5 signs can aid you in preparing both emotionally and practically for what lies ahead. With understanding, you won't be caught off guard. Instead, you'll be able to maximize the time remaining with those you hold dear. And if you are finding this information helpful, please like, share, comment, and subscribe. Your support helps us continue creating content that empowers you to take better care of yourself and your loved ones. Now, let's begin. One of the earliest and most telling indicators that a person may be approaching their final year is unintentional weight loss. At first, it might seem trivial: a belt that needs tightening, clothes that appear looser, or a once hearty appetite that begins to wane. Many families attribute this to aging, but unexplained weight loss is rarely a positive sign. It often signals that the body is no longer efficiently absorbing nutrients, muscle mass is diminishing, and essential systems are slowing down. While aging naturally leads to some muscle loss, rapid decline suggests a deeper issue. The body may struggle to digest food or process protein, leading to muscle wasting. This loss of strength not only hinders movement, but also increases fall risk, weakens the immune system, and heightens vulnerability to infections. Another cause of weight loss in the final year is appetite changes. Many elderly individuals simply don't experience hunger as they once did. Their sense of taste diminishes, food loses its appeal, and they might skip meals or eat smaller portions. This isn't just preference, it's a physiological change. The body, sensing its decline, no longer signals the brain to seek food as frequently. This results in less energy, diminished strength, and a gradual decline in overall health. Underlying medical conditions also play a role. Weight loss is a common symptom of chronic diseases like cancer, heart failure, or kidney disease, which can progress long before other symptoms appear. Even depression or cognitive decline can lead to reduced eating, creating a downward spiral. Some families try to encourage their loved ones to eat more, offering favorite foods or protein drinks. But if weight loss persists, it's crucial to recognize that the issue transcends diet. It's the body preparing for a profound transition. At this stage, forcing large meals may not be beneficial. Instead, focusing on comfort, easy-to-eat foods, and hydration can significantly improve quality of life. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, pay attention. This isn't just about physical appearance. It's the body sending a message, and understanding it can help you prepare for the road ahead with clarity, compassion, and the ability to make every moment meaningful. Another noticeable change in the year leading up to the end of life is deep, persistent fatigue that doesn't subside with rest. It's not just feeling tired after a long day, It's profound exhaustion that makes simple tasks feel overwhelming. Getting out of bed becomes a challenge. Walking across the room requires effort, and routine activities feel draining. This isn't just aging. It's the body conserving its remaining energy. As organ function slows, the body prioritizes essentials. The heart doesn't pump efficiently, circulation weakens, and muscles don't receive adequate oxygen. This is why many elderly individuals feel weak, unsteady, and unable to sustain their usual activity levels. Metabolic slowdown is another factor. The body, designed to produce and use energy, redirects it toward preservation in its final phase. This is why someone in decline may sleep more, need longer naps, and struggle to stay awake. They may experience sudden energy drops, seeming fine one moment and completely drained the next. The emotional impact of fatigue is heartbreaking. Many seniors, once independent, feel frustrated or embarrassed that they can't do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies. This can lead to isolation, accelerating decline. For families, watching a loved one go from active to exhausted is painful. It's easy to assume they're lazy, but forcing activity won't help. Understanding their limits, allowing rest, and making their days comfortable is crucial. If you notice deep, ongoing fatigue unrelieved by rest, take it as a sign of a major transition. Cherish conversations, create moments of peace, and support them without expectations. What matters most isn't how much they can do, but that they feel loved, understood, and at ease. As a person approaches the final stage of life, striking changes can be seen in how they think, communicate, and interact. You may notice forgetfulness, difficulty following conversations, or disorientation in familiar places. They may repeat themselves, forget names, or lose track of time. These cognitive changes can happen months or a year before death. This isn't just forgetfulness. The brain, like other organs, requires oxygen and nutrients. As circulation weakens and oxygen supply decreases, cognitive function declines. They may become confused, struggle to make decisions, or fail to recognize people and places. Some may have moments of lucidity, followed by confusion. Emotional withdrawal is another sign. They may lose interest in social interactions, speaking less, engaging less, or sitting in silence. It's not that they don't care, but their brain no longer processes emotions and engagement the same way. Conversations become tiring, loud environments overwhelming, and they retreat into their own world. Mood and behavior changes may occur, with increased irritability, anxiety, or detachment. This isn't just personality, it's the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express. For families, this stage is difficult. Watching a loved one lose touch with reality or pull away emotionally can feel like losing them before they're gone. But it's important to remember this isn't something they can control. Instead of trying to bring them back into conversations, meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, confused, or less engaged, don't ignore it. These are often early signs that the body and mind are preparing for the final transition. Be patient, cherish quiet moments, and create a safe, familiar, and peaceful environment. Even when words fade, love and comfort can still be felt. As the body begins to wind down, a weakened immune system is a clear physical sign. You might notice that someone who rarely got sick now catches every cold, flu, or infection. Minor illnesses take longer to recover from, and simple wounds heal slowly. These changes aren't random, They're signs that the body can no longer defend or repair itself as it once did. Repeated infections are a major concern. Pneumonia, UTIs, skin infections, and oral infections become more common. Even antibiotics may seem less effective, requiring stronger medications, longer recovery periods, or multiple rounds of treatment. Chronic wounds are another issue. If small scratches, sores, or bruises aren't healing properly, it could mean circulation is compromised. Poor blood flow means oxygen and nutrients aren't reaching the skin and tissues efficiently, making healing slower. Pressure sores become a serious risk for those who are less mobile. Infections in the final year of life often don't look the way we expect. Instead of a high fever, an elderly person may simply seem more tired, confused, or less interested in eating. A sudden decline in mental alertness is often the first warning sign of an infection. Recognizing these changes early can make a difference in how much comfort and support they receive. For families, watching a loved one go through repeated infections can be frustrating and heartbreaking. It's tempting to push for aggressive treatments, but at a certain point, the focus shifts from curing to comforting. Keeping them hydrated, keeping their skin clean and moisturized, and minimizing stress can do more for their well-being than another round of medication. If you notice repeated infections or slow healing, pay attention. These are often indicators that the body is losing its ability to fight back. Focus on comfort rather than cure. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one breathes more slowly or shallowly than before. They might pause between breaths, or their breathing might become irregular. Some people experience Cheyne-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. Weakened circulation is another common sign. You may notice that their hands, feet, or even their nose and ears start feeling cold to the touch. The skin may appear pale, bluish, or mottled. This happens because the body is prioritizing blood flow to vital organs, reducing circulation to the extremities. Some people may also experience sudden drops in energy, feeling fine one moment and completely drained the next. This is the body conserving energy, shifting priorities. They may sleep more, needing longer naps, finding it harder to stay awake. This isn't laziness, it's the body adjusting. Forcing activity won't help. Understand their limits, allow rest, and make their days comfortable. As the body prepares for its final phase, circulation weakens. You may notice cold hands, feet, or even their nose and ears. The skin might appear pale, bluish, or mottled. This happens because the body prioritizes blood flow to vital organs, reducing circulation to the extremities. It's a clear indication that the heart isn't pumping as strongly. Some may experience shortness of breath, even with minimal movement. Sitting up, speaking, or shifting positions might cause them to feel winded or out of breath. They may breathe more often through their mouths or need to stop and catch their breath while talking. If they were once able to walk across the room easily, but now struggle, their lung function may be declining. In some cases, fluid buildup in the lungs can make breathing difficult. This can cause a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. Many assume it's just congestion, but for elderly individuals, it's often a sign of weakening lungs. These changes can be frightening. You want to help, to encourage them to take deeper breaths, to believe that something urgent needs fixing. But sometimes the best approach is to simply be present. Offer reassurance, create a peaceful environment, and understand that this is the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can provide relief. In some cases, medications or oxygen therapy can help, but the focus shifts toward comfort rather than trying to fix the issue. As we conclude, reflect on what we've discussed: significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often emerge in the year leading up to an elderly person's passing. They may not all appear simultaneously, and they might not always be obvious. But when you start noticing them, it's a sign that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It's natural to want to fight against them, to encourage them to eat more, move more, or push through exhaustion. But sometimes the best thing we can do is listen to what their body is telling us. Instead of focusing on trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death. It's about being prepared for it. When you recognize these changes early, you can offer better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with love and dignity. This is a time to cherish moments, share stories, and let them know they are valued and not alone. If you're noticing these signs in someone close to you, take a deep breath and remember that you are not alone in this journey. Many families have walked this path before. While it's never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.